So in the coming months, we are due to reach a fairly significant milestone for us of independently facilitating and tracking close to $100 million in what we would consider micropayments to the last mile inside Syria. This would have been absolutely impossible without the work of our core team inside Syria, some of whom were featured in that video and join us today online. I'd like to briefly acknowledge them by name, if I may. Abdul Khalik, Abdullah, Abdul Hamid, Farouk, Hussam, Jassem, Jaur, Luai, Saad, and Yasser. They are a very dynamic, agile, and extremely committed group of people displaced from all over Syria and were previously teachers, horticulturalists, pharmacists, bakers, metal workers, social workers, small business operators, you name it. Their work is divided into particular geographic zones, and we concentrated initially in the territory of northwest Syria, where 3 million people are now identified as in need of humanitarian support. But we've now worked in almost all the governorates of Syria, supporting the flow of funds to charities otherwise unable to access their donations. We now arrive at the subject of compliance and bank de-risking trends. I'm going to hand over now to our guest, our leading sanctions expert, Dr. Erica Moret, who will paint the picture as she sees it. Dr. Hamza and I will then pick up on some of the practical solutions we've been piloting, testing, scaling over the past few years.
Thank you very much, Edwina, and thank you, Dr. Hamza, as well. It's a real honor to be here with you today. And thanks to all the participants as well for joining us. I know you're coming from all over the world, and this is such an incredibly important topic, so I'm very happy to be discussing it with you today. As Edwina said, I'm principally a sanctions specialist, but I've been working now on Syria for many years, as well as a number of other countries around the world. And the area I've been specializing increasingly is the humanitarian side of sanctions, particularly in relation to financial sector de-risking and over-compliance that you tend to see among humanitarian organizations and other parts of the non-for-profit and private sector. So as we know, Syria represents one of the most pervasive and complicated humanitarian and refugee crises in the world. The impact of the now 10-year conflict in the country has had tremendous implications for the ordinary people in Syria who are still remaining in the country, and of course those who have left as well. And the average Syrian faces incredible difficulties in accessing essential goods, healthcare, basic services, and so on. The conflict has also seen, of course, the direct targeting of health workers and hospitals and all of the other things that come arm in arm with armed conflict. Turning to the sanctions now, the situation in Syria is an incredibly complicated one when we look at the sanctions and wider compliance picture. As many of you will know already, Syria really represents one of the most complex cases that we see in the world today of sanctions. The US imposes a very broad package of measures against various targets in the country. The EU sanctions that are in place against Syrian targets represent among the most strictest and broadest sanctions that they have ever used. And then these are joined by measures imposed by the UK, the Arab League, Switzerland, Canada, Turkey, Norway, Australia, Japan, etc. On top of this, we also see a whole spate of other types of related regulations, counter-terrorism regulations, and those designed to curb the financing of terrorism, anti-money laundering regulations, export controls, and so on. At the same time, the UN also imposes a range of terrorism-related sanctions on certain targets within the country. So what we see here is a scenario where there are multiple overlapping sanctions regimes in place, and we also have some extraterritorial or secondary US sanctions on Syrian targets, which basically means that the private sector in particular, banks and other commercial entities have become increasingly wary to operate in Syria, alongside a number of other countries as well, Iran, Venezuela, Cuba, North Korea, and so on. But Syria is one of the really, really complicated ones. And what do we mean by de-risking? Well, when we're talking about banks and financial institutions, we basically mean the increased wariness of operating in a country like Syria or in servicing transactions of funding going into the country. So what we've basically seen as a consequence is the whittling down of any form of formal banking channels into the country, to the extent now that there are very limited ways that the international community and international commerce and so on can actually make any form of payments into the country. This is partly due to de-risking, but it's also partly due to the context within the country. And that, of course, differs a great deal according to the different areas within Syria, the government-controlled areas in the northeast and the northwest. Outside of the areas of government control, as many of you will well know, there are really no formal banking facilities left, or very few. There are no more cash points. Money transfer operators like Western Union are few and far between, if at all. Even the sending of personal remittances has been seriously curtailed, and this is a subject of one of my other projects at the moment with the UN. And that also impacts on informal form of remittances, such as hawala coming into and around the country. So this has been exacerbated, of course, by the pandemic, with border closures, with restrictions on freedom of movement within the country and from the neighbouring countries in the region. And it plays into what we see across the world now as a global crisis in de-risking, and its very notable humanitarian consequences. And this has been described as such by the likes of the IMF, the World Bank, the G20, Financial Stability Board, Financial Action Task Force, and so on. It's increasingly being recognised as well by governments and the EU and the UN as a mounting problem. And Syria is one of the worst problems when we compare them to other contexts of war and other types of crises around the world. So within this scenario, there are very few options left for Syrians to access money, but also for people working in Syria to be paid, for hospitals to be able to pay for their goods, and so on. And there are a number of different proposed solutions out there. There are various initiatives going on within the EU, within individual member states, at the UN, and so on. And the various proposed solutions of these various initiatives around the world, and I've reviewed them in an earlier study, there are over 40 of them looking at de-risking. Some of you may be surprised to hear. And some of the proposed solutions range from changes at the policy level. We need to change the sanctions. We need better dialogue across all those imposing these different measures to provide better exemptions for humanitarian organizations. We need better sharing of best practice and training and capacity building within banks, within the humanitarian sector, within governments, because really it's still a very technical and complex subject that there isn't a great deal of understanding across sectors still. But when we move down the chain, unfortunately, these types of proposed solutions have been really slow in being implemented. They often lack political support. And so what we're increasingly looking at is how can we solve the problems at the other end of the scale? And this is where the work of Amanacard comes in. And really within the Syrian situation, in the Syrian context, and from the work that I do with others, this seems to be a really inspirational model for how to bring funds into a country like Syria, where there are very few options remaining. So it's an innovative approach. And I'm really happy to be here today with you to learn more about it as well. And I think the more we can raise awareness of what you're doing, and also continue the dialogue with other people doing similar things elsewhere in the world, the closer we'll get to finding, a small step forward in continuing to help support health workers and the work of those providing humanitarian assistance and so on. So I'll hand back to you. Thank you for having me, and I'm looking forward to hearing more about your work as well.
One thing that I do want to acknowledge upfront about Syria in particular is that it is what we call in the humanitarian sector a protection crisis above all else. So there's no doubt that people like Hamza's experience is one of, it's more of a human rights challenge than a kind of food insecurity challenge. Despite this, life must go on in such an environment, and it has been 10 years. People need to go to work, they need to feed their kids, they need to stay educated, have babies, get medical treatment for chronic illnesses on top of war-related injuries, etc. So donor governments, some of which are present on the call, with their implementing aid organisations, have stepped into part of the void by providing employment to people on the ground, supplying food, medical, and other basic services, all of which involve some degree of cash-based transactions given the restricted access to banking in the country. So when we set out in 2016, we came out of the independent sort of expert space into more of a practitioner role in this. We started by meticulously mapping payment routings for individual charities from the source of the donations to the end point. And this has been incredibly intensive work. Some of our customers are on the call, and they'll hear me when I say that. It's usually, you know, pretty intensive sort of consulting level work, but we're trying to do it as part of a package with a wider solution, which we'll talk about in a minute. But we are at a crossroads where, without stronger collaboration across the aid sector, something that we highlighted back in 2013, greater accountability or ownership of the challenge by governments, and probably a centralized banking solution, our service that takes in the full view of the source to the end recipient is not sustainable as it stands. So what can we do as an independent third party that would continue to build the confidence of the key stakeholder groups? And as we see it, that is the banks and the donating publics, about the very big question, where does the money go in such a scenario? Well, we can actually focus almost exclusively on the last mile. So what does this entail? In banking terms, we focus on continuous CDD, KYC, and transaction monitoring and real-time reporting. So the first step we took was to categorize aid recipients into 3 main classes indicated by the color of their Amanacard. So we wanted to champion the families first and give them the gold card. So they're the ones on the top of the pyramid, often put at the bottom. We've got workers who are honored with the sky blue color, beautiful color in Islamic art. And royal blue represents the small business owners and facilities that keep everything going, the engine of the economy, despite everything falling apart around them. So people are assigned one of these categories based on the first touch point that we have with them via a charitable organization. But we soon enough find that if they were onboarded as a janitor in a hospital, they reappear in a family distribution in a camp because they're displaced and in need of humanitarian support beyond their low wages. And it's kind of a wonderful moment when we meet these people in different places to see, you know, where they're at in their journey. So when a charity enters into an agreement with us, we help them, first of all, to profile their risk exposure across the 3 classes and apply a proportionate response. The personal data of each recipient undergoes a disciplined process of scrubbing, which includes things like standardizing the transcription of the Arabic script of personal names into English. And the final critical step is independent face-to-face re-verification of the person. And this can even happen one-to-one, especially with medical workers struggling to attend payment rounds because of their shift work. I think you'll see in a moment an example from a team member that literally yesterday shared with us a picture of a new card holder who works at a hospital. He went to find him and hand over the card one-to-one. There's always one person behind every big payment round. You know, it always comes down to an individual. With higher risk categories, such as suppliers of products under sanction, like fuel, which I hope Erica will touch on in the Q&A, the cardholders will also undergo continuous sanctions screening. Now, as you can imagine, building trust and respect of people and protecting their information in the climate, in the protection crisis that is Syria, are absolutely critical aspects of our process. And Dr. Hamza is going to cover this point in his segment. But once people are onboarded, our objective is to ensure that 100% of the donation reaches the end target with minimal risk. Now, I'm not going to cover the logistics of how all of this works in practice, it's quite involved, but from a systems perspective, the recipients are divided into 2 levels, intermediary and individual. In the first case, they're onboarded to receive money in bulk on behalf of a larger group of people. So that would be like a hospital, a school, an NGO office. And this cash is then dispersed onwards to individuals, so health workers, teachers, NGO workers. Each person or entity is onboarded with an account on a platform which is digital. So by its very nature, they can take it with them even when they're on the move. And again, we've got some amazing stories about reconnecting with people across the years who we met via one charity and then they've displaced to a new area and we re-engage them in a different setting. We have this example a lot with hospital workers, where a hospital has received donor funding for a certain period and then stopped. And then literally 2 years later, another donor comes along and picks them up, and we've got all of the account holders already onboarded onto the platform, so we can verify that they've been consistently working as an anaesthetist or a surgeon in that particular location. Again, bringing a real knowledge of who's behind a particular transaction. The main event is then tracking the transactions that take place between two parties, always two parties. They use their accounts and our mobile apps to confirm what was exchanged in the moment of the transaction. Now, this could be cash, food, vaccines, anything that's donated at the last mile. An electronic real-time transaction reports are generated and validated by photographs from our independent field team supervising the process where this is appropriate. Often this happens much more intensively at the start when we work with a charity, and then over time people get used to the discipline of what's involved and we can take a lighter touch approach. And this fundamentally deals with the fraught issue of manual paperwork, a bugbear of us all, but also the source of human error, fraud, inefficiencies, lost time, all things that one doesn't have when managing a high tempo operation in a war zone, and something that Hamza, I'm sure, will cover in a minute. So essentially we're moving from, I've got some exhibits here, something like this, which is a very common kind of look and feel of a document that's signed and stamped by multiple players, to a transaction record, which this is actually digital. This is an example of one payment round with 25 hospitals through one charity, 2 donors, the European Union and USAID, with thousands of transactions all monitored and captured in real time, and then signed, co-signed by the cashier involved in the process who handled the cash, and the administrator of the hospital or the school or whatever the facility is, and us as the independent third party. So we have gone completely paperless with the exception of one key document. We call it the consent form. And this gives us the opportunity when we meet a new account holder to sit with them, explain carefully their data rights, and to see how they write their key details in their own hand, something that we often refer back to if there's any doubt when we have different charities coming on board and they say, we've got this new person and actually we've already got them on the platform, and we can go back to the original source document. These forms are assigned when we meet them and directly uploaded to our platform and then destroyed in the same day that they were completed. So in summary, the crux of the last mile piece, if we were just literally to focus on that to help equip the 3 main stakeholder groups, charities, banks and governments, to feel confident about operating in these environments. We've got independently verified face-to-face KYC, CDD screening. We've got a transaction that takes place with dual authentication of 2 parties, which generates in turn real-time data that can be used to inform better operational decisions on the ground, and then retrospectively to kind of look at trends and things like that, which help adapt programming on the ground. Underpinning it all is the importance of data protection. So a very key thing is anonymizing information, which Hamza will go into, and securing it. And also looking for opportunities to adapt internal admin processes. Again, the bane of our lives. We try and find as many opportunities to automate these as much as possible. So I'd now like to bring this to life with a couple of short videos. The first is of a cash agent inside Syria. Just a little bit of background about him. He's someone we've worked with for a number of years. He was one of the earliest cash agents to be accredited. He's been facilitating, he's relatively small, but he's facilitated significant work on behalf of the European Union in Aleppo and Idlib, so northwest Syria. And this kind of gives you a sense, the fact that he's willing to sort of go on camera and talk to you all. We do have permission to share his dialogue. The fact that he's willing to do that shows that, you know, over time, building that trust and really verifying who someone is and getting to know them, their community, etc., really helps us enrich that KYC picture that's kind of scary and shrouds, you know, what is commonly known as, say, a hawala operator, when actually he's just a business operator running a currency exchange house.
مع خلق أمان لكافة الجهات مع الشركات الصرافة ومع المستفيدين. شركة أماناكارد هي مشروع رائد في المناطق عندنا هون، في مناطق الحروب، حيث يتم توزيع كافة الرواتب أو المستحقات إلى مستحقيها عن طريق البطاقة الذكية. أماناكارد بشكل عام سكرت أو أغلقت جميع الثغور بما كان في السابق، جميع الثغور أو الحوالات الغامضة.
The second video, we're going to actually look at a fuel transaction, and then we're going to show what it looks like in the system.
السلام عليكم، يعطيك العافية. حضرتك عندك لك مستحق عن طريق شركتنا، فأعطينا البطاقة المسحة لو سمحت لنعرف الرصيد اللي معك.
So you can see that he's authenticating, and then the cash agent here is advised how much to pay. We are effectively the cameraman as the independent third party standing next to the cash agent. The fuel merchant re-enters his PIN to reconfirm exactly what he got. So we know in that moment that he's happy that he received a certain amount of money. And then if we need to, we can print a receipt, but the receipt is digitally generated at the same time in the app that is available to the user. The charity has access to this screen. So in that actual moment, this is what the charity actually sees in the transaction. So you'll see there's a receipt number, which is unique at the top of the screen, the date and time stamped with GMT, the total that was paid out as something else. So a digital point is set up as equivalent to the value that the aid organization wants to set for the program. So in this case, the aid organization has set a point equals $1. We have the supplier's name, the card serial number, and then anonymizing references. So you wouldn't necessarily have access to all of this information if you're looking at this from, say, Gaziantep or Jordan. You might have a sort of stripped down version of this. We have an even more dynamic version of it. So some of these elements are actually blued out, and we can click on them and then see deeper KYC information on them. So there's a note in here you can add to a transaction. This shows that in this case, the charity is covered by a general license issued by OFAC. The purpose of every transaction is also set by the charity when they do the top up. So it's just like a bank transfer where when you get asked what the purpose of the transfer is. An underlying source of funds is also always identified. So in this case, it's a USAID funded program and the project code. So you can see on the right-hand side, there's also 2 digitally generated receipts, which you can expand and save to your phone, which is often used by the merchants. If they're part of a network, then they'll want to be using that to indicate that they've delivered their part of the job. That's pretty much where I'll stop, and I'll hand over to Hamza, and he can pick up on some anecdotes from his experience, both inside Syria and then on the other side, working with us in London. Thanks, Hamza.
So hello, everyone. Pleasure to be with you both. Of course, in this panel, like Erica and of course, Edwina. I'll be quick because it's very hard, to basically solve all the financial situation regarding Syria in 1 hour. So I'll try to be very quick. And I'll spoke a little bit from my experience being a hospital manager during 4 years in Syria. And I would say am I okay to describe it as a cultural shock when I came as a refugee to the UK and then understand how things going on, especially also after joining Amanacard. So basically, to be very short, in Syria, when we're receiving the funds from the NGO, I had to drive around 70 kilometers for like a specific cash agent or hawala agent to receive that money. And in order to receive the money, I would sign like so many papers and then provide the cash agent with my passport copy or my like ID copy, where he take a picture of it and then send it via WhatsApp to someone who I don't know where this photo of my ID going to. And then I take the cash, depending like $50,000, for example, or 70, put it in my pocket, drive back to Aleppo, which was like the most dangerous city in the world. And when I came to the UK in 2018, I assumed that this is how the usual life works here. So I had like £1,000 in my pocket, put my passport in the other side, and then went out with my friends. And they were all asking like, why you have all this cash in your pocket? Like you might be robbed, like nobody here works with cash. Same thing regarding my ID, like why you have it all the time with you? And I said, because like this is how things work. Like I thought like this is the norm. When then I realized that no one basically from our donors would dare to do the same thing in their countries. They're like in the London or New York, in DC, they won't walk around with cash. They won't walk around with their passports, allowing people to take photo of it. And that was like the first kind of a shock I got. The other thing is like the amount of paperwork we had to do. When I thought that this is the only way how donors can like justify the funds and all of this, and like the amount of many like paperwork signatures in order to verify and justify everything how it wants, like all the money, the employees and all of this. And then I realized like here also, like no one basically do this anymore. And in fact, like I was shocked because things definitely can work like in a different way. Like it's very, I won't say it's easy. Like it usually change is not easy, especially in maybe like humanitarian world. I don't know, like someone has wrote this guidance of how to work, like, I don't know, 1950, and they kept like stick to it. That's it. There is a lot of things developed, of course, for many, like in many sectors, but it looks like in this like financial sector of sending money to crisis areas, it hasn't been like much, a lot of work has been developed since ever. And being a hospital manager responsible for like 110 of hospital staff, like sending all those like people's signatures, IDs, copies, their like real names, and we do it via emails. And I also thought that this is the way how it works, until suddenly like I was like, when I sending my ID to someone here, for example, they immediately like respond, please don't share that, it's very risky, like there is a dedicated platform we have in the bank to deal with this, or we have like our platform to share this securely. And I was like, but you were like forcing me for 4 years to send 110 IDs and signatures and names via email, and no one has ever tried or think of changing that. And like especially like it's very kind of like the situation in Syria about like hospital workers and hospital like the facilities when being like deliberately targeted all the time. It's just like, I hoped that NGOs that time will be like more sensitive about this data that they were sharing. And basically like for people who are living in a conflict areas, they we should work more in order to make their life easier, in order to make their life safer. But the attitude I was getting when I was like living there, like you're living in a conflict area, your hospital might be bombed at any moment. It won't hurt you like to drive this extra like 70 kilometers. It won't hurt you to carry this cash with you. It won't hurt you like to share your ID. Like it's fine. Like you're in dangerous anyway. And that's when I joined basically Amanacard and understand that things really can work differently, and like things like, and easily, not only like differently, like very easily for the organizations, for the donors, and also for especially for the aid workers on, or like these real service providers on the ground. And like I don't know how many of like the 105 people in this panel are from donors basically, but like like for USAID people, ECHO, they felt like, guys, we think of you as the bad people. We think of you as that you are the kind of the demon that force us do all of this. But also what I understand that you're not, like you basically want just to make sure that the funds you're giving is sent directly to the real recipients without like following all kind of like the like Erica will know how to phrase it like better in academic way, like following all the money rules, let's say. But basically, like you usually don't tell the organizations, the NGOs or INGOs how to do it. You just ask them to do it right, and you don't interfere. And because they want to tick this box for you, they make us do a huge amount of work, taking like a very extra like long mile of risks in order just to fulfill, okay, we have used like this specific Hawala agent that we trust, while like it can be done differently in a different way. And I won't take more time. I'll just like shared my frustration with all of you, and yeah, looking forward for further this discussion.
Yeah, I think your point about the proportionate use of paperwork, you know, our experience is when you get down to the question of who needs this, it's not often clear. So as you said, Hamza, the impression of someone on the ground is, oh, this is coming from the donors, but actually it could be, you know, there's 3 layers. It could be the UN, INGO, diaspora NGO, local NGO, lots of layers, and there's this perception that between them all they need to have this certain amount of reporting, which then kind of becomes meaningless because it's just a pain, and so people just sort of reel it off, and as you say, tick boxes, you know, when things are a bit too invasive. Like one thing that we've tried to push back on is banks feeling they need to ask for everybody on a beneficiary list details, and we don't think that's proportionate at all to the requirement. So we try and satisfy the bank with the processes that are, so the KYC, CDD processes that are underpinning the accounts, and then the transactions that are being monitored, and how we've got the independent view of that. So it's more the process and the use of technology in that we find is the kind of good mix than a sort of pure tech solution. I'm sure Syria is made ever complex by the fact of its positioning and all of the cross-border operations that are running around it, because we've got so many other governments' considerations to be taken into account, like the Turkish, the Iraqi, Lebanese, Jordanian. Inside Syria, what are the rules? You know, there's different governing authorities, there's the state. So, you know, whose rules do we follow? Then we've got the international system of rules on top of that. And we've got international humanitarian law. We've got, which obviously banks don't necessarily see themselves as you know, measuring themselves first against. They'd be looking at international financial regulations. So it's incredibly complex patchwork for someone inside Syria trying to just get on and run a hospital or run a school to work out, well, what do I need to do here? And I think it's, you know, we've almost confused things too much. I mean, Erica, you touched on the complexity, but I think people need to go a bit deeper into that, especially in the different parts of Syria. You know, how does one grapple with the ever shrinking space in some areas, expanding in other areas for different governing groups? When a bank asks you, you know, are you dealing in a sanctioned country? Are you? Because are there general licenses that can cover your activities in some parts of the country versus not? These are extremely complex, you know, questions that I don't think any of us are that, you know, 100% clear on. So the one thing for sure is a bank will be very concerned about ultimately when the money goes dark, because when it leaves the banking system and goes into cash, which inherently is fungible, where does it go? Who is it going to? What is it funding? And that is the one area that I'm suggesting that we continue to focus on as independent third-party support to charities, because it does provide that extra layer of protection. We don't have a vested interest in the programs. We look at everything fresh. A team comes in, they're new people into a program, and we do discover things, and we discover it with the charity and help them improve their internal processes at the same time. So it's not like we're a policeman. I think that's another important thing to point out about independent monitoring, that especially in Syria, there's been a lot of monitoring that has felt quite it's felt quite secret, or, you know, like secret shoppers going into shops and cash programs, or, you know, people reporting on people not knowing one another in a network. And, you know, we're trying to bring a different kind of a more trusted third party, real-time support to charities.